Hey Canceristas, it's Anne from But Doctor I Hate Pink. I haven't done a lot of videos lately because I really don't have a good place to do it. There's no light in here or anything. It's a gorgeous, beautiful, wonderful, sunny 80-degree day in end of October, and it's dark in my house, but I'm doing the best I can. So today I want to tell you about going to the hospital. It's a sad fact that a lot of us with cancer will end up going to the hospital once or twice or more during the course of our illness. One of the more common things that happens is we get neutropenic fever, which is when our white cells go down too low and we get an infection. It's usually caused by something going on in our body and not something we catch. Cut. Okay, so for me, that was when I had C. diff. I got a C. diff infection quite badly. I went septic. And at that time, I learned from my long hospital stay that there were things that I really needed that the hospital couldn't provide. And ever since then, I put a little hospital bag together. It's something that I can grab and go and has little things that I need that will make me happy that the hospital can't provide. And of course, when you're really sick, like I was when I had sepsis, I was in ICU and, you know, I was too sick to care about anything. But when you start to recover, even when you're very ill, things will start to annoy you that you have at home that you don't have in the hospital. Yeah, you can have somebody go get something for you, but then you kind of have to do without till then. So here is my little hospital bag. It's a tiny Chanel fake bag. Well, it wasn't fake, came with some Chanel perfume, and you will see on the zipper is the most important thing. Is a safety pin. What I do is I safety pin this bag near my bed, on my bed, and that way everything in it is handy. I also have several other safety pins in the bag that I can use. You want kind of a large one, like this size or even larger. Even a baby diaper pin would be good, because you want to tape the phone that you use to call the nurses also to your bed, especially if you're having a mastectomy, because you're not going to be able to move your arms, and those phones have a way of falling to the side where you can't reach them. And it's a sad fact of life that nurses are just super busy and aren't going to check up on you very often, and you could be sitting there for hours needing something and nobody will notice. So you really do want to have that phone near you. So get a big safety pin, put the cord through the phone, the hole of the safety pin, and pin it to your bed. You're not going to damage the cord, and the phone will be very handy for you. So that's the first thing I recommend. I always bring my iPhone because recovery in a hospital is terrible. I bought the new iPhone 6, the largest one. I always treat myself to an iPhone, the newest iPhone, because it's a necessity for a sick person. You just live on it. And I used to bring my my iPad to hospitals, but now with this large iPhone, I don't need to do that anymore. So, of course, you need your iPhone cable. I have a spare I keep in the bag, and attached to that, I have a lightning cable and a 6-foot UPS charger. And that way, I can plug it in behind my bed, and it will reach all the way over to the bed, and I never lose charge. I can also use one of my safety pins and pin this to the bed, and then I always have my phone available. So I highly recommend that. This card was $6. You know, these are a little expensive, but $30 maybe, but they come with your phone, so you can probably find them. And then the lightning cables are everywhere now. I've seen them for a couple bucks, so that's easy. Another thing I keep with me is tissues. Well, you all know I have a runny nose. My nose runs 24/7. That is from the Herceptin, I believe, and I also have some problems that I'm not gonna, that require surgery that I'm not gonna do. So, tissues. They give you tissues in the hospital, they sure do, but they're rough. And when you use tissues as often as I do, you want softer ones. So, bring your tissues. Another thing is scented hand wipes. You may not get to clean yourself as often as you want. They will give you, you know, they do give you bed baths and stuff, and they're really nice. I mean, when you're dirty and sick, they feel good. But sometimes you just want to freshen up. So I have a couple of these wipes with a nice scent so that I can just feel a little more refreshed. Another thing, contact case. I wear contacts. I need a contact case. I also bring spare contacts because you really do need contacts. You may get sick enough so that changing a contact is not easy, or taking them out and taking them in. I do also have the kind that I sleep in, but you never know if they're gonna get dirty or nasty or anything, so spares are good. Also glasses. Now, I haven't worn glasses since I was 14 years old. I can't see through these. They make me super dizzy. They make me feel like I'm on a roller coaster, but I have them just in case. I can kind of put them on for a second. Your own comb. You need your comb. They're going to give you one of those little tiny black nasty ones. If you have really thick, horrifying hair like I do, you probably need something better. Lip gloss. You've got to have your own. They will bring you something super hospital-y, and it's just, you don't want to use it. It's like chapstick or something. You need something more moisturizing, and hospitals are very dry places, so yeah, you'll use a lot of this. Another thing, hand cream or any kind of body cream that you can stick in your little bag. I just got this in my Ipsy bag to replace the Cetaphil, which is getting old now. That's another thing, you gotta keep track of how old these things are. Fortunately, I haven't been in the hospital in a while. I don't particularly love this one, so it's gonna be my hospital bag. But it's got like a strawberry clean scent, and that's what you need, you know, when you're overwhelmed with hospital smells. Another thing, something to tie your hair back with. Hair can be annoying in the hospital, but more annoying is a broken nail. Hospitals do not give you these. If you break a nail or chip a nail, they're not going to have this. And it's, I don't know about you, but nothing drives me crazier than having a broken nail and having no way of dealing with it. So put one of those in. Yep, you're going to want to shave your legs at some point in your hospital stay if you stay a long time, as I did. There may be other places you need to take care of hair too, so this is a way of handling that. And this one, it's kind of up to you. It's a little tiny mirror. This was actually a gift, and you can see how pretty it is outside. It was actually a gift, and it's cute. She brought it back from me for China, and just once in a while you want to look at, maybe that cute doctor's coming in, you want to check yourself. I don't bring makeup or any of those kinds of things. I mean, usually you're too sick to care, but you might need it to put in a contact or whatever. And that is really it for my hospital bag, except for with one more thing, tweezers. Tweezers come in handy. You cannot do without tweezers in life, and hospitals also are not going to give you tweezers. So there you go. The one other thing that I carry, because I have problems, is a little thing of afrin. The hospitals, if you're on a drug regimen, hospitals will give you your drugs. but they will not give you this afrin. I don't know why they can never come up with it, but I am an afrin addict and I need my afrin, so I keep an unopened one in my hospital bag. Now, you're not supposed to bring in any of your own drugs when you go to the hospital. They want to know what you're taking. I have had experiences where the nurses didn't give me my at-home drugs. So I usually bring extras just in case I ask and they don't bring them, then I know I have them. That's probably not hospital policy. It's not recommended. They need to know what goes in you and what comes out of you. So that's just up to you. But they're not going to have afrin or any nasal spray kind of stuff. So if you want that, bring your own. Okay, so I hope this helps. I hope it gives you an idea. I just keep this little bag on underneath my nightstand, and hopefully I will never need it again. But it sure came in handy when I was septic. I could barely walk. I could barely think. I was just need to be carried to the hospital. But I had this bag, and when I was out of ICU and in recovery, it definitely helped me to have these little comfort things that I need. So decide what you would need for a stay and get extras and put them in your bag. Okay, so find me on my blog, But Doctor, I Hate Pink. I'm on Twitter, But Doc, I Hate Pink. I'm on Facebook, But Doctor, I Hate Pink. And I'm also on Instagram, But Doctor, I Hate Pink. Instagram is the one place that I don't post a lot of medical stuff. Everything else is medical. But the Instagram is more my pictures of my life and stuff. And there's not a ton on there, but I'm getting into it. Okay, subscribe. Bye.